The E-nside actually is the only for precannulated off-the-shelf device we can use for thoracoabdominal repair. And the concept of having the inner branches in all the vessel we can take off is something that is crucial for our patient and for the intraoperative outcome and also midterm and long-term outcome. The advantage of having the precannulated technology is something that could help the physician not only during the inner branches cannulation, but also for stabilize all our accesses from above or from below and with our sheath in order to make easier the life of each physician to put a bridging stent inside the final destination. The E-nside, from my experience and from my center experience, is something that we want to use, of course, in urgent and emergent cases, and in particular in thoracoabdominal repair, in which we have a lot of space inside the aorta for tackling the vessel and for deploying all the device. The precannulation system is something very useful also in case we have like a tightening of the aorta lumen at the level of the renal artery, because we increase the stability and we can gain space between the graft and the aortic wall, pushing toward the sheath inside the inner branch with the precannulated technology. The precannulated technology is something that you can use or not. In our experience, we almost use in all the cases, because again, you can be fast in cannulated the inner branch. You have a lot of stability from all the system you decided to use, coming from above or coming from below with a steerable sheath. And in case you need to remove the device and the sheath, of course, from the groin for reducing the time of the ischemia, you can lose the precannulated technology and deliver all the graft. Limb ischemia, when we are using, of course, a large bore access, is something that we need to care every time. We watch the clock immediately after the first deployment of the graft, and we consider maximum 1 hour and a half of limb ischemia for complete our procedure. In case we have such difficulties of issues during the procedure, we could easily remove all the system and coming from above or below, cannulated the inner branch and complete our surgery. Of course, we are treating a thoracoabdominal or complex aortic patient, so it's not just an issue related to the graft, but it's an issue related to the procedure. This graft allow to physician also that actually work without an hybrid room with standard C-arm to be faster and to increase the possibility of cannulated, of course, the inner branch, also in an AP projection, avoiding lateral projection that could also decrease the quality of the image and increase the radiation dose. So it's something that definitely help a surgeon to start with a program for complex aortic repair or thoracoabdominal one.